We'll spend the last portion of the class discussing healthcare reform. We'll have 2 student presentations about it because it affects our lives in many, many ways. Its formal name is actually the Patient Protection and Affordable Care Act. Some people call it Obamacare. Some people use Obamacare as a derogatory term, but the president also calls it Obamacare. And I'm sure many of you know we spend a lot of money in the U.S. on health care. And we spend a lot, but we get very little for it. So we spend more than a lot of other people, a lot of other countries, and we don't get the quality that, that we want in comparison to other countries. So we'll hear a little bit more about that from the presentations. It was signed into effect March 23rd, 2010. I was actually at the conference for the American Journal of Health Promotion that year in Hilton Head, and people were very, very excited about that. But of course, we really didn't know how it would all play out. So the legislation was signed, but really it's the writing of the legislation, the rules, the implementation that is going to be taking effect over the next, really decades. It's still extremely controversial, even though it was upheld as constitutional by the U.S. Supreme Court about 1 year ago. So it is constitutional. The controversial pieces, and we may discuss these a little bit more in class, involve what's called the individual mandate, in that a person must purchase insurance. And this was one of the reasons why the act came about, was that people who don't have insurance will go to the emergency room and then their costs are very high. If they have insurance, it forces people to have insurance. But that is allowed. That was declared constitutional by the U.S. Supreme Court. There are also other components of healthcare reform that when a lot of people will say, no, I am not for this at all. I want nothing to do with this. But when you ask them about some of the specific components, they say, oh yeah, I really, really like that. So, so there's a little bit of a disconnect between people saying, I don't want anything to do with this, but yet when you ask them about some of the components of it, they say, oh no, that's really good. We should definitely do that. So let's look at the major highlights here of healthcare reform. Pre-existing condition coverage. This is for use, yes, under the 19 years of age. So, we covered last class about congenital heart disease. So this is really important. So if you have a child that has a congenital heart defect, it would be very difficult to get any type of health insurance, life insurance for that child if you change employers and you have employer-sponsored health care, which most people do. They can deny that child coverage. They can deny that child coverage for a specific period of time. So this is something that changed dramatically with healthcare reform. So this is one of the things that when people say, no, I'm not in support of healthcare reform, but yes, they are in favor of pre-existing condition coverage, especially for children. Because as we mentioned with congenital heart disease, these kids are having multiple surgeries in, hours after birth as small children and throughout their lives. So it'd be very difficult. You can't really do anything about a pre-existing condition if you were born with it. So there are funds to make it affordable, and if you want to click on the links from the other slides, take a look at the insurance plan. The adult phase-in for pre-existing conditions is going to start next year, so that's important to remember. Children are covered, but adults are not. That is going to be starting to be phased in. Other details that are really important too, that especially affect a lot of you, that young people, young adults, are one of the largest groups of uninsured. So this plan allows you, the healthcare reform allows you to stay on your parents' insurance up to age 26, even if you're no longer a student. A lot of health insurance plans cover you only as long as you're a full-time student, and once you graduate, you were kicked off. So now you can stay on up till age 26. Now, the premiums still need to be paid by your parents, but at least you're able to stay on a plan. And it's interesting because you can even stay on your parents' plan if you're married, but it does not include the young adults' children. And of course, now what happens when people turn 26? Then they do have to find their own insurance plan. Another important piece of the legislation that, once again, and people say, oh, I really think this is a great idea, versus, saying, oh, I'm not in favor of healthcare reform, but, oh, we like this. Eliminating lifetime caps. Many plans had a maximum payout on them. So say it was $1 million or $2 million. Well, think of the child that has the congenital heart defect. You're going to be coming up against that $1 million pretty quickly. I knew a lady who had a baby that was born premature. The child spent a month in the NICU, the neonatal intensive care unit. The bill was $500,000. So, children with disabilities can get to these caps pretty quickly. So then what are you supposed to do? Have a car wash if you've gone over your maximum cap? So that's one thing that has been really popular and beneficial, even though when some people say they don't like healthcare reform.